You know that if you let your guard down and feel that you do not need to be careful, you don't have to worry about sexual practices or safe sex or what have you, then what you might see is an increase in cases in the general population. I might point out that the predominant spread into the heterosexual population in this country, in the United States, is predominantly around the IV drug abusing population and their heterosexual partners. So if you look, for example, in Manhattan, in South Bronx, in New Jersey, or in Miami, where there's a high concentration of IV drug abusers, the heterosexual spread is focused in those areas with high IV drug abusing populations.
Why? The scientists are, like you say, they are considered the final arbiters of what's good for the planet or what's bad for the planet. And they hadn't got the slightest idea. Instead of wearing white robes, they wear white lab coats, you know. Instead of bringing you the word of God, they bring you the word of the EPA or whatever. And they don't have to understand what it is that they're making you do, in fact. And people, you know, I think they fall naturally into it because there is a need in humanity for something like a religion. Something that makes you feel a part of some larger kind of group, something that you think, in spite of your wormy little life, makes you a part of something good, something big. When beliefs get tangled up with facts, matters of fact become matters of religious kind of significance, where if somebody gets mad at you for asking him a question in a scientific meeting, or says, we're never going to have Kary Mullis at the European Union of whatever kind of scientists, so they put it in Nature, because he came in there and had the audacity to tell people that it might not be that bad to have sex, that AIDS might not be something you get from sex, that I don't see any evidence for it, is all I said. I don't see any evidence for it. Why? You can't tell young people that.
Today there are many scientists and physicians working within the conventional institutions who have similar viewpoints to those of the dissidents. Well, why don't they come out? Why don't they speak their minds? Is it possible that they take a look at what has happened when you do question the HIV equals AIDS equals death hypothesis? They've been suppressed. Dr. Peter Duesberg, noted scientist, was the main person in the line of fire.
Peter is a very scholarly person in addition to being brilliant too. He's very careful. He doesn't say anything that he can't support. And also one of the most brilliant people surely the most brilliant virologist.
Yeah. Sure. Well, I think if you ask virtually any scientist who's involved in this area, his claims are really extraordinary. They're way off base. He puts forth a negative hypothesis. He says everything you've heard is wrong, but I'm not going to give you any alternative. It's really unfortunate because what he's doing, he's creating a tremendous amount of anxiety in the people who are infected because they think that there's some conspiracy among scientists against them. It really is very unfortunate. And coming from him, he has some qualifications. Something happened to him in his thinking over the past couple of years. I don't know what it is.
Peter Duesberg at the University of California, Berkeley campus is seen as someone who is now dangerous. His funding has been cut off. Graduate students are encouraged not to take his courses, and I think his administrative duties have included being in charge of the department picnic.
My funding, for example, from the National Institute of Health will not be renewed as of this year, and I may be out of business then. Also, my colleagues have essentially excommunicated me. I'm not invited to meetings, or hardly ever to meetings anymore, not ever to one on AIDS. I'm not allowed to publish in the same journals anymore as I used to. Even as a member of the National Academy, I cannot publish in the National Academy my views that drugs may be the cause of AIDS. And I have plenty of evidence to support it, to document my claim, which might be very relevant to the health of millions of Americans and people on this planet. Yet I'm censored because I'm essentially considered to be an outcast or an odd man or somebody who has controversial views.
He was a really well thought of guy too because of his ideas, the whole field. I mean, in cancer, he's the guy that led him into the whole oncogene thing, you know. Big research bonanza. Anybody who could order a little kit from some company and hire a couple of technicians could be a cancer researcher because of things that Peter opened up. And then Peter said, no, I don't think that's actually the cause of cancer. And that made those guys a little bit angry. And then he comes along and does the same thing for AIDS. He said, you know, I think we're on the wrong track here.
AZT is an antiretroviral drug that became the first drug approved for the treatment of AIDS and HIV infection in 1987. It was originally intended to treat cancer, but it failed to show efficacy and had unacceptably high side effect profiles. However, the unavailability at that time for alternatives to treat AIDS affected the risk-benefit ratio greatly.
The antiviral drugs are chemotherapies. They're all based on chemotherapies that have been developed 30 years ago, long before AIDS was known, to kill human cells. Chemotherapy is restricted to a few months in the hope the cancer dies before you die.
If you started taking any other chemotherapeutic agent for the rest of your life, it would be that agent probably that killed you. You know, when you give chemotherapy to somebody with cancer, you give them a round of it for maybe 14 days or a few days. Hopefully you're not going to kill the patient, you're going to kill the cancer. The patient's going to survive. But you don't keep giving it to him until he dies, because he certainly will.
In the early 80s, the public believed AIDS was a sexually transmitted disease that only affected gay men. But after the discovery of an infant being diagnosed with the virus, Fauci made comments in the Journal of the American Medical Association claiming the possibility that routine close contact, as within a family household, could spread the disease. This news immediately set off alarm bells as mainstream news outlets such as AP and the New York Times began reporting on household transmission of AIDS. Well, of course, we now know that the infant contracted the virus through their mother's womb, but the damage had been done. Public panic had intensified, and people were fearing they could get AIDS from sharing a toilet seat or even from shaking hands. People living with AIDS were being alienated and ostracized from their jobs, homes, communities, and gay men in particular were heavily stigmatized. On the treatment front, Fauci and the team of scientists at the NIH began frantically working on a vaccine, believing that would be the way to end the AIDS epidemic. Confident in their work, Health and Human Services Secretary Margaret Heckler declared in 1984 that an AIDS vaccine would be ready for testing within 2 years. But banking on a vaccine proved to be harder than it seemed. 2 years passed and there wasn't one even ready for testing. The public was losing patience. Pharmaceutical companies were also racing towards a treatment for AIDS, realizing the incredible potential for profits. In 1987, one such company was Burroughs Wellcome, a British drug company who showed in a test tube that their failed cancer drug, AZT, could be repurposed to treat AIDS. Limited studies were done, long-term side effects were unknown, but in record speed, in less than 4 months, the FDA approved the drug as a treatment, claiming the benefits outweigh the risks. One of the parameters of the speedy approval process was for the drug company to bring back follow-up data in 2 years. Burroughs Wellcome agreed, but of course, since the drug was already approved, they never really needed to follow up, and so they didn't. Celia Farber did incredible reporting on the approval, use, and dangers of AZT for Spin magazine in the late 80s. In her article titled Sins of Omission, she writes, quote, "The majority of those in the AIDS-afflicted and medical communities held the drug up as the first breakthrough on AIDS. For better or worse, AZT had been approved faster than any drug in FDA history, and activists considered it a victory. The price paid for the victory, however, was that almost all government drug trials from then on focused on AZT, while over 100 other promising drugs were left uninvestigated." Now, the expensive drug made Burroughs Wellcome record profits, and at the time, it was the most expensive drug ever marketed. But people were desperate. They would do anything to get their lives back. Despite numerous doctors raising concerns about the toxicity of the drug, some even saying that it was doing the very opposite of what it claimed to do, that is, it was actually shortening the lives of their patients, Fauci and other health officials disagreed. In 1989, Fauci began to promote the drug, not only for critically ill AIDS patients, but for anyone who tested positive for HIV, including those asymptomatic who showed no signs of disease. Those patients included hospital workers, pregnant women, and even children. Doctors were stunned. The data the NIH released was limited, but nonetheless, the NIH had gone all in on AZT. Despite it becoming clearer and clearer that AZT was toxic, caused liver damage, and destroyed white blood cells, the drug continued to be used for several years after, while calls from activists and doctors to study any other possible treatments went ignored. One such treatment that was ignored was Bactrim. PCP was the leading killer in AIDS patients, and many doctors were prescribing the inexpensive antibiotic as a prophylaxis to prevent AIDS victims from developing the rare pneumonia. There was evidence that the antibiotic should be used as a prophylaxis whenever the reoccurrence rate of PCP for a given condition was over 15%. The reoccurrence rate of PCP in HIV-positive patients was over 60%. Despite the science, Dr. Fauci declined to conduct a clinical trial. Doctors and advocates continued to push for its use, and finally, a couple years later, it was adopted, after thousands of patients had already died. As Fauci and the NIH focused on vaccines and AZT for the treatment of AIDS, hundreds of drugs went unstudied, many of which were demonized. In fact, the movie Dallas Buyers Club is about treatments AIDS patients desperately sought after because of the inability to access them legally. Many doctors advocated that the best way to treat patients was to focus on mitigating the severity of the ailments that would ultimately kill them rather than trying to eradicate AIDS altogether, that the virus mutates too quickly to waste all resources and time on a vaccine or other preventatives, that everything should be studied, all avenues explored, and all options should remain on the table. But unfortunately, that's not exactly how the AIDS epidemic was handled. Big Pharma got their payday in AZT. Millions of dollars allocated by Congress went to vaccine research, which never produced anything effective. And meanwhile, along the way, hundreds of drugs and treatment options went unexplored. And we still don't have a cure for HIV. The epidemic never went away like people hoped. We do, however, have effective treatments that help people live a good, long life with the virus. There were a lot of mistakes made along the way, a lot of lessons that could have been learned. But after looking into the history of the AIDS epidemic, it's curious if we've actually learned any. Here we are today with a pandemic that is causing mass hysteria. Like the days of people demonizing gay men as the culprits behind the epidemic, we have the media demonizing the unvaccinated as the root cause for why this virus just won't go away. Many hope the vaccine would stop the spread and eradicate the virus, but like AIDS, the virus seems to mutate too quickly. The same way Fauci discouraged and even prevented inexpensive treatments from being talked about, researched, and prescribed back then is the same thing that is happening today. And in the end, with the lack of a promising cure and a realization that the virus is likely here with us to stay, many who fear exposure to HIV have chosen to wear a condom to protect themselves, just like those who fear exposure to COVID are choosing to wear a mask.
Up there isn't an up there there. There's no place up on the Academy of Science is just a bunch of idiots, just like everybody else. You know, the editors of journals, austere journals even, they're just busy with their little lives and stuff. There are no old wise men up on the top making sure that we don't do something really dumb.